It has been just over 2 years since the World Health Organization made this announcement.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Now, some experts argue this pandemic was actually a symptom of a much bigger problem: our world's deteriorating ecosystems. We spoke to scientists about what we learned these last 2 years and how we can prevent the next pandemic. Where did COVID come from? Scientists have been investigating that throughout the pandemic. 2 studies released in late February point strongly toward infected bats at a market in Wuhan, China. It's an animal-to-human infection, what researchers call zoonotic spillover.
There's 2 major components. One is the conditions that allow the bats to be infected and to be excreting the viruses. And those are conditions usually of environmental stress. Another event that has to happen is there has to be contact between humans and the pathogen.
The National Institutes of Health estimate that spillover accounts for 75% of new infectious diseases. That has more scientists embracing the concept of One Health.
One Health is a concept that our health, humanity's health, is intertwined with the health of ecosystems and the health of animals, including wildlife and livestock. When we have a breakdown in the health of one species, it can then trickle on to affect the health of others.
Humans and animals are in closer proximity these days for lots of reasons: land management, deforestation, intensive farming practices, and climate change. That creates new opportunities for diseases to spread.
If a bat is shedding a pathogen in a forest away from humans, then no one cares. It doesn't matter to anyone. But if a bat is shedding a pathogen and there's a person nearby, or it's shedding a pathogen in a village because it's seeking extra food sources, then we can see a spillover event. If you can imagine, every time we're encroaching into natural habitat, stressing wildlife populations, bringing people and wildlife together, particularly within the context of wildlife trade, where we're aggregating multiple species, we're stacking them on top of each other in cages in extremely stressful conditions, animals defecating, urinating on each other across species, and then transported along supply chains where you're aggregating more and more animals. I mean, these kinds of conditions are the perfect storm.
Jack Dangermond is the founder and CEO of Esri, a geographic mapping company.
By putting geographic stuff in the computer and overlaying these layers, you can see things, you can analyze things and see things that are only imaginable.
Esri software helped visualize the spread of COVID, making the pandemic easier to understand.
It, as a technology and as a piece of media, woke up the world to the fact that we're all interrelated.
The COVID-19 pandemic brought into sharper relief for us just how important it is to get these predictions upstream as far as we can to head off these types of catastrophes.
Everything is connected, and if we don't have sort of this ecosystem approach to solving problems, then we're going to solve them in little tiny bits and pieces, maybe not understanding the consequences to those vast systems that are interrelated.
In 2009, the CDC established a One Health office. Its efforts focus on education as well as collaboration with other health agencies.
I think for people working in the area of One Health, the fact that an emerging coronavirus could cause a global pandemic is not a surprise. It's something that we've seen evidence of with the severe acute respiratory syndrome back in 2003.
But knowing the links between ecosystems and outbreaks is one thing. Making the changes we need to survive is another.
This pandemic is a symptom of our faltering relationship with nature. We need to look very carefully at how we are connected and our health is connected with the health of ecosystems. And until we start to do that, until we start to value ecosystem health as a service for human health, then we're going to see more and more events just like the one that we're experiencing right now.
I know that we are in a very dark place with COVID-19, and it feels like we're never going to get out of it. It feels like this is just a harbinger of more disease issues to come, and maybe that's true, but I don't think that this is something to despair over. It is a wake-up call that we have been fortunate to learn from now, and I think that it really is a sort of a motivator, and it's initiating a sea change in action that I think we will see the benefits of for decades to come.
Let's continue now with Dr. Barbara Hahn, a disease ecologist at the Carey Institute of Ecosystem Studies. Dr. Hahn, welcome.
Hi, thanks for having me.
So talk about what you've been looking for these days. I understand that you use artificial intelligence and mapping to study zoonotic disease outbreaks. What are you seeing these days?
Yeah, we're looking for, the goal for the SARS-CoV-2 work is really to try to get ahead of what we thought was happening down the line, which is that most humans are the ones carrying it now. Most of us have been infected or are going to be infected at some point. And so the idea was, well, if it came from an animal and it got into humans and now humans have it, the chances of it getting back into an animal are quite high. And we just wanted to get ahead of it and think about what are the animals we should be surveilling? What are the species that we could be looking at now to prevent new variants from arising? So that's what we've been working on. We've been using machine learning and whatever data we can get our hands on to make these predictions.
Last week, the UN Environment Program joined an alliance with the World Health Organization to implement a One Health approach. What's your sense of how other nations, non-governmental organizations, intergovernmental bodies, of how seriously they're taking this idea now?
I think it is. I think there's no question that the world leaders have considered zoonotic diseases to be a problem, but I think that there's no ignoring the fact that we have to act on it now. And so I think that these types of initiatives, these sorts of global coalitions that are coming together, are really important for taking action on things that scientists have been warning about for years. So what we have is a lot of knowledge built up, and there's still more knowledge to be gained for sure, but what we need is action. What we need is organized, sustained, a full court press, right, to get ahead of things and to keep moving in a direction where we know we can make a difference in prevention. And I think this is one really great step in that direction.
I have to admit that as educated and thoughtful a person as I am, when I heard about this, the first thing my mind flashed to was every zombie movie I have ever seen. Human to animal diseases is World War Z, it's I Am Legend, it's Resident Evil. It's like all of these stories that don't end well. Are we talking about something that is just kind of bound to be a mortal threat to all of humanity? Not necessarily zombies walking around, but you know what I'm getting at. Like this idea of animals passing diseases to humans, it never ends well, and we never get ahead of it. Like, how concerned about this should we be?
I mean, I wouldn't take it lightly. I mean, sure, those movies exist for a reason because we have this fear that it could happen, and I think we should pay attention to that. But I also think that we should look around us and think about what we've achieved as a human society, right? I'm on Skype with you right now. I mean, we're in lockdown and still making the world go round. And so I'm very optimistic that science and the world leaders, action takers, folks who really care about taking care of sick people, taking care of conserving our planet and making sure that we are growing in a sustainable way. I think science can achieve a lot, and science has achieved a lot. And I think the coronavirus pandemic is that wake-up call. I sense a sea change in the way that we are tackling these kinds of complex and global problems. I see a change in the way we are investing in our future. So yeah, zombie movies are, I'm a scientist, so I'm not going to say it's a 0% chance, but I will say that I remain quite optimistic that we, as scientists, have some more tricks up our sleeve. I think that we have some solutions to offer here.
I won't be upset if you say it's a 0% chance, but that's a whole other conversation. The other thing that this made me think, and I hear you in terms of the optimism, I really do, because we did accomplish a lot based on years of basic research. Once COVID-19 showed up, we were able to accomplish quite a bit in a rather short period of time. The other thing I would ask you about before I have to let you go is this also made me think about the effort to get people to recycle, right? There's been a lot made of the individual steps we can take to save the planet. And lately, we've been talking about the gap between what people can do on their own and what governments have to do together, because it's the only way to make major changes. How much of the response in this kind of One Health way of thinking, it has to do with things that I can do individually, as opposed to things that the world has to do collectively?
I think it goes hand in hand, right? I mean, when we look at our backyards, when we look at our lawns, like we want to be clean. We want to take good care of ourselves. We want to take good care of our bodies. Those little incremental changes in like, let's not use as much water. Let's be a little bit cleaner about the kinds of products that we buy. Let's make sure to recycle. I think these small changes are easy to implement as individuals. And I think if we collectively understand that our small actions can add up to make a huge difference, not just in preventing zoonotic spillovers, but in giving us cleaner water, cleaner air, and that One Health framework that all of health is interconnected, including our own. I think that it feels more empowering. It feels like we have a role to play in solutions.
And very briefly, in our last few seconds, is there one small step that you would ask more people to take?
Be better consumers. Think about what you're buying and the footprint that it leaves on the planet. And I think that as consumers, we have a lot of power with our dollars. So thinking carefully about what you're investing in and what you're not investing in is a really important step.
Dr. Barbara Hahn of the Carey Institute, I appreciate you indulging my zombie reference. These movies, I think they are way overdone, and they keep me up at night, so I don't like them. But I appreciate you helping me understand this idea and what we can do. Thank you very much.
Well, I hope you can rest easy tonight. Thanks.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.